When I first learned about this a decade ago, I thought for sure that the limits that we had would at least be somewhat safe. I had no idea that there was such a lack of accountability at the federal level. So I'm thankful for all the presentations that have come before that can set me up for what I'm going to talk about, which is our lawsuit against the FCC, where we challenged the FCC's determination that they didn't have to do a full review and update these limits, which were set in 1996, and as has been presented, are based on science from much, much earlier. So they don't protect against biological effects, children's vulnerability. I mean, we didn't even have the science at the time when they decided that heat was the only harm. In 2019, the Federal Communications Commission, that's the entity in the United States that has authority regarding regulations on cell tower, cell phone, Wi-Fi, and so forth, radiation. They made a decision not to update their limits. And there had been thousands of pages of scientific evidence, expert evidence, organizations filing recommendations that the FCC do launch a full review. However, the FCC decided that they didn't need to do a review, and we filed. The court decision was issued in 2021 in August. The determination was that the FCC had ignored evidence of long-term exposure, of children's vulnerability, the testimony of people who'd been injured, like the families in Pittsfield, and there were over 200 testimonies related to that, impacts to the developing brain and reproductive system, and there was also a complete failure to address environmental impacts. And you can go online to Environmental Health Trust and learn all about the lawsuit and all about all of these other issues. But I wanted to focus on Berkshire Eagle piece because I too, there was this line in there that said, don't take it from us about how there's no evidence, take it from the National Cancer Institute, the World Health Organization, the EPA, and the National Toxicology Program, not to mention independent research. And I would have been right there thinking, well, of course, you go to the National Cancer Institute page and it seems like there's no problem. It doesn't say in a big, bold statement, hey, we haven't looked at this issue, but let me share with you a few things that I wish I had known and that I would love for everyone who's watching this to know. So let's start with the National Cancer Institute. The National Cancer Institute has not done any review, systematic review, or evaluation on the issue of cell tower, cell phone, radiation at all. So this is confirmed in several ways, of which I'm going to share. Denise Ricciardi, who was on the call earlier, had written a letter to the National Cancer Institute. And in the New Hampshire State 5G State Commission, you can go in and see the email communications between the New Hampshire Commission and the National Cancer Institute, in which they confirmed, when she asked, what is the National Cancer Institute's opinion on the safety of 5G, 4G, and cell towers, that as a federal research agency, the National Cancer Institute is not involved in the regulation of radio frequency telecommunications infrastructure and devices, nor do we make recommendations for policies related to this technology. Our sister agencies, the FDA, as well as the FCC, retain responsibility for reviewing guidance on safety concerns and informing the public if these circumstances change. Now, I had written the National Cancer Institute earlier because my local school board had told me the same thing. They said, well, the National Cancer Institute says it's safe. They say it right on their website. And I have documentation and letters where they communicate to me that neither the literature reviews nor the fact sheets make safety determinations. So as I'm going to be talking about, there has been no review of all of the research by any federal agency with expertise in health and environment. So let's look at also the World Health Organization. The link goes to the EMF project site. Now, I don't have time to go into it, but there's actually two entities at the World Health Organization. It's under the umbrella of the WHO, but there are two separate entities. One entity is the EMF project. They have not done any reports, research reviews, or determinations since 1993. The Berkshire Eagle opinion piece goes to this page on 5G. And if you actually look at it and click on it and go to what is the WHO doing, they talk about how they are doing a review that should be published in 2022. And if you continue to say, well, oh, they're doing a review, well, when did they last do a review? It's actually 1993 that the World Health Organization EMF project last did a health risk assessment. Now, there's all kinds of issues around conflicts of interest that I can't go into that have to do with this particular entity at the WHO. But remember that the International Agency for Research on Cancer, which is under the WHO, did classify radiofrequency radiation as possibly carcinogenic to humans in 2011. And since then, numerous experts who actually served on the WHO, International Agency for Research on Cancer, working group, the scientists that got together to make that determination, have determined that the science is robust enough to determine that radiofrequency radiation is at least now a probable, if not a proven carcinogen. Dr. Christopher Portier, who's the retired director of the United States Center for Environmental Health at the CDC, who served as an expert to the WHO and also retired director of the agency, U.S. Agency for Toxic Substances and Disease Registry. He filed a report in a lawsuit with a actually, there's several people who have brain tumors they're alleging are from the cell phones. And in this report, he states that the science is enough to determine that the probability is high. There's also Dr. Leonard Hardell, who has published many papers concluding that radiofrequency radiation is a human carcinogen. So what of the EPA? Well, the EPA did have a robust review research program that they were doing for many years. In fact, what I'm showing you is slides from a presentation that they did to the FCC. They were developing safety limits for radiofrequency radiation, and they would be based on health effects, and they were fully defunded from doing that. When the Telecom Act was passed in 1996, one of the most heavily lobbied bills in the United States ever, I think. I think it's actually ever, certainly at the time. And they were fully defunded, and the FCC, as discussed, took on the limits from industry groups. Now, when you go to the EPA, it's actually all goes to the FCC. All the web pages were scrubbed, updated. They don't have any report that the EPA itself has done, but instead simply parroting FCC language. Then we go to a letter that the EPA wrote me, because I wrote the EPA and I asked them, what is your stance? Have you made a determination? Because everyone seems to think you have. And I actually got a letter from attorney Leanne B. Veal. She's the director of the Radiation Protection Division of the Office of Radiation and Indoor Air at the EPA. And she said, the EPA's last review was in 1984, and we don't have a mandate for radiofrequency matters. And she answered all of my questions, basically saying, we haven't reviewed it, but we've made no determination. So what of the National Toxicology Program that was cited in the Berkshire Eagle? Well, they looked at this issue with a $30 million animal study, and they were asked by the FDA to do that because there was inadequate research on long-term exposure, and they were asked decades ago. They finally came out with their findings, which were that there is clear evidence of tumors in the hearts of male rats, some in the brains of male rats. There was damage to the heart, and there was also DNA damage in tissues of the mice and the rats. This is a quote from Dr. Linda Birnbaum, who filed a statement in one of the amicus briefs. And she said, overall, those National Toxicology Program findings demonstrate the potential for radiofrequency radiation to cause cancer in animals. And also, I don't have time to present all of this, but Dr. Ronald Melnick, who led the design of the National Toxicology Program study, also has published numerous papers and given many presentations. You can go online to watch those, talking about how the study is important. It shows that there are non-thermal effects and there needs to be reductions of exposure to protect the public.
What does the public need to know? There have been multiple studies have found increases in cancer associated with exposure to radiofrequency radiation. This is animals and humans. Because of the widespread use of cell phones, even a small increase in cancer risk would have a serious public health impact. I strongly feel precautionary principles should be promoted by health and regulatory agencies, especially for children and pregnant women. The agencies in the US say, if you are concerned. That puts the burden on the individual. It doesn't say, we are concerned. It should be very straightforward. Precautionary principles should be promoted because, as mentioned earlier, risk can be greater for children than adults due to the increased penetration of the radiation within brains of children, and the developing nervous system is more susceptible to tissue-damaging agents. So finally, what is the lesson that should be learned? When dealing with assumptions, I think we've shown that assumptions in this case can be wrong, so that we should no longer assume that any current or future wireless technology, including 5G, is safe without adequate testing. Thank you.
The FDA, that many people say, well, okay, not the National Toxicology Program, not the EPA, not the WHO, but the FDA, they say it's safe. Well, the FDA recently wrote a mother in California who wrote the FDA asking, I got this cell tower in front of my home. Is this safe? Show me where you determined it was safe. And I should add that the FCC, actually, we have a record of a lawyer writing back to this mother saying, the FDA says it's safe. The WHO says it's safe. Then when asked, well, where are the reports? He couldn't find them. So then she wrote the FDA, who in the response said, the FDA does not regulate cell towers or cell tower radiation. Therefore, the FDA has no studies or information on cell towers to provide in response to your questions. And I would also just end with this University of Pittsburgh Law Review, which came out last year. It's entitled, The FCC Keeps Letting Me Be, Why Radiofrequency Radiation Standards Have Failed to Keep Up with Technology. And this is a discussion of the policy and the failure of these federal agencies to create safe guidelines that protect the public. And this wasn't mentioned, so I had to mention the captured agency, because this sort of ties all the pieces together. I mean, how did this happen? I know I asked myself, well, wait a minute, we're all using cell phones, there's cell towers everywhere. There's, in my community, we're getting towers 30 feet from homes with no say, no notice, no nothing. This is happening across the country. And this Harvard report from 2015 documents how the wireless industry is using the tactics of big tobacco. Not only are they involved in the science, but there is millions of dollars into Congress. The FCC is captured. We have former industry leadership who is at the leadership of the FCC and actually paved the way for the situation we're in now. So I recommend that because they explain how we sort of got to where we are. And in conclusion, there's been no systematic review of the totality of evidence by any U.S. health or safety agency. That's in our court documents in our case. And also, if you listen to the hearing in court, you can hear an inquiry where one of the judges is saying, well, wait, how do you know that long-term exposure is safe? Where is it? Where's the document? Where's the report? And there was nothing that the FCC could provide except to say that they made that determination, but there was no report, review of all of the science. So I won't read the quote, but you can go to Environmental Health Trust to learn more. And I thank you so much. I'm glad to answer any questions afterwards.